Cancer of breast is not anymore a disease of the Western nations. In urban India, the incidence of breast cancer is growing. Maybe it's a change in our diet pattern. Maybe the number of children that the modern woman in the urban cities have is far less than what it ever used to be. There are various reasons, but the fact is the incidence is going up. Sadly, we don't have any programs, mass programs for early detection. Well, there could be some controversies on screening programs, but nevertheless, it's very prudent to go in for mammograms, clinical evaluation, self-breast examination, especially when there's a family history of breast cancer. When there's a family history of breast cancer, the probability that the progeny, the female progeny, will get breast cancer is slightly higher. There's a hereditary pattern to it. There are ways to identify that. There is BRCA1 and BRCA2 investigations. But my suggestion is that don't just do it in isolation. Always have a genetic counselor, because not that everybody who inherits that will necessarily get breast cancer or many other cancers, which is a part of that syndrome, if you wish to call that. So, in brief, we must be aware that breast cancer is, in a woman is vulnerable to breast cancer, especially when they are not breastfed, when the children are far and few in between. But it doesn't mean that one has to go in for more children. It must be kept in mind. This is only a certain statistical association that they have a higher risk. Now, what's the point in diagnosing it earlier? Is it like inviting anxiety much before when it's not necessary? It's not so. When we do find out, when we do identify that there is a lump which is cancerous, or the discharge which is a harbinger or something sinister beneath, then it's time to see what it is. If it is cancer, there are solutions. In our lives, I think we generally face two kinds of problems. Problems with solution, problems which don't have solutions. If a woman is detected with breast cancer in its early stage, that's a problem with solutions. In fact, there are plenty of them. So when there is an early breast cancer, there are ways wherein we can preserve breast and have the treatment which is cosmetically acceptable. There was a time when almost everybody underwent mutilating surgery, what we used to call as radical mastectomy, which was started by Halsted. It's not anymore the case. If women are postponing to be aware of themselves and making an effort to find if they have an early breast cancer, fearing mutilating surgery, then that's highly inappropriate in today's age. Early breast cancer is potentially curable. It's far less damaging and distressing to treat early breast cancer with appropriate treatment than to ignore it and then be a victim of it or succumb to it. So what are the treatment options? There are many treatment options, and the various combination of surgery, radiotherapy, chemotherapy, hormone therapy, immunotherapy, hypothermia can ensure that the patient lives a fruitful, productive, high quality of life. Now, when a woman undergoes what we call as a breast conservation surgery or a BCT with axillary resection or otherwise, it's generally supplemented or followed by a brief burst of radiation or 5 to 6 weeks of radiotherapy to ensure that it doesn't come back. If sometimes the tumor is slightly bigger, then surgery is preceded by chemotherapy. The tumor is shrunk, and many times we can knock it off, follow it up by again a good post-operative radiotherapy. The fear that radiotherapy can cause hair loss, damage to eyes, and any permanent damage to underlying organs is unfounded. Most of the side effects, both immediate and late, are acceptable. In fact, the immediate side effects are hardly any except some for pigmentation. So the fear of complications should not keep patients away from potentially curable therapeutic options. There are many options: hormonal manipulations, immunotherapy, heating the local recurrence. So it's not anymore a disease which has a death warrant when somebody gets it. Breast cancer incidence is growing, especially because we have more and more people living longer. If we know how to detect early with appropriate screening programs, investigations like self-breast examination, clinical evaluation, mammography, MR mammography, sonomammography, a whole lot of technology out there. You got to keep your doctor in the loop. It's very important. As much as one should be aware of one's own body to detect any change in oneself, which can prompt immediate attention by oneself and the doctor. Breast cancer is potentially curable. Don't postpone your self-breast examination or clinical evaluation. See if you can find it early, especially if there's a family history. Seek the appropriate counseling from genetic counselors to obtain a certain test. Technologies have changed, science has changed, and I'm sure it's going to change even further. It's no more hope, or it's no more a wild hope to retain one's breast and go out in the bikini for a good swim in the sea even after breast cancer. Thank you.